one of the main points, particularly concerning the use of drugs in pregnant and breastfeeding moms, is that there's always some drug you can use, and you need to continue to look for that drug that's safest in that mom. It's very important. I think another very important point is that keep the mom healthy. That's the most important thing a clinician can do, is keep the mom healthy. We know that babies who have healthy moms have better neurobehavioral development, and outcome is much better. You don't want a sick mom, so find some sort of therapy that will fit and fit the mother's condition. And you can always do that if you just look hard enough. Yep. Two, I think we have to realize that all mothers are going to use drugs. They're all going to use some kind of drug. And it's always a good idea to look at that drug closely to see its implication in breastfeeding and see if it does transfer. Most drugs don't transfer into breast milk at clinically relevant levels. Everything transfers into milk, but for the most part in subclinical ranges, so it doesn't really matter. There are a few, maybe 10 or so drugs that transfer into milk at really high levels. You need to be quite cautious with those. But for the most part, most drugs transfer in subclinical ranges, and that's really important to remember, to try to keep moms breastfeeding in most situations. There are some conditions where you have to be very careful. Radioisotopes, you have to be quite careful with those. You have to be quite careful with certain kinds of ergot alkaloids and things that might suppress milk production. So you have to be cautious with certain kinds of drugs, and particularly the cancer drugs. You have to be very careful with those.